What if I told you that your bleeding gums aren't just a sign you need to floss more? What if they're your body's first warning flare, signaling a problem your doctor might not spot for years, leading to a misdiagnosis or the silent progression of a major health issue? It sounds dramatic, but your mouth is one of the most honest parts of your body. In this video, I'll show you exactly what your dentist sees that your doctor doesn't. This isn't just about your teeth. It's about catching a serious problem years before a routine physical might, especially when it comes to your blood sugar. I've spent my career seeing the patterns that connect the mouth to the body. And the number one pattern is this: what happens in the mouth almost never stays in the mouth. I see so many patients who are frustrated by oral symptoms that won't quit. They're told it's just sensitive gums, but the real problem isn't in their mouth at all. It's a reflection of something deeper. Think of your gums as a high-resolution mirror for your internal health. The tissues there regenerate incredibly fast, so they're one of the first places to show stress when your body's core systems, like your metabolism, start to go off the rails. Today, we're going to break down those warning signs so you can become the number one advocate for your own health. Before we get into the clues, we have to talk about one thing: inflammation. When your gums are red, puffy, and bleeding, that is inflammation. Here's where most people get it wrong. They assume the problem is just the bacteria in their mouth. But the real issue, the twist, is when that inflammation doesn't stay put. Think of it like smoke from a small fire in one room, your mouth. At first, it's contained. But that smoke eventually fills the whole house. That smoke is systemic inflammation. Inflammatory signals and bacteria leak into your bloodstream, creating a low-grade, chronic inflammatory fog that puts a huge strain on your entire system. This is the direct link between the health of your gums and the health of your heart, your brain, and your metabolism. Let's start with the most ignored sign of all: gums that bleed when you brush. The common mistake is to blame your toothbrush or your flossing technique. But what if you're doing everything right and your gums are still constantly red, tender, and bleeding? This is a pattern I call "it won't heal." And it's a huge red flag. This isn't a hygiene problem. It's a healing problem. Your body is trying to repair itself from the daily attack of bacteria, but it can't keep up. This is one of the classic first signs of blood sugar issues, like prediabetes. When your blood sugar is chronically high, it damages the tiny blood vessels that bring oxygen to your gums, choking off their supply line for repair. On top of that, high glucose weakens your immune response. The result? A tiny issue that should resolve in days becomes a chronic fire that never goes out. For many people, stubborn gum inflammation is their body's first clear signal that their metabolic health is in trouble. Another warning sign is a persistently dry mouth, a condition called xerostomia. I'm not talking about post-workout thirst. I mean a chronic sticky feeling that's there even when you're hydrated. It's easy to write this off as a side effect of medication or aging, but it can be a direct result of high blood sugar. When there's too much glucose in your blood, your kidneys work overtime to filter it out, pulling water from all over your body. This leads to systemic dehydration and a sharp drop in saliva. Here's the surprising implication: losing saliva is a much bigger deal than you think. Saliva is your mouth's built-in defense system. It washes away food, neutralizes acid, and kills invaders. When you lose that flow, you lose that protection. A dry mouth isn't just an annoyance. It's a sign that your mouth's natural defenses are down, often because of a much bigger problem. Now we get to what happens when those defenses go offline. Maybe you've had a perfect dental record for years, and then suddenly, at your latest checkup, you have 3 new cavities, or you develop a stubborn white film on your tongue that your dentist identifies as oral thrush, a fungal infection. This isn't bad luck, it's biology. That combination of a dry mouth and saliva that's higher in sugar creates a perfect storm for bad bugs. The bacteria that cause cavities thrive on sugar, using it to produce acid that dissolves your tooth enamel. At the same time, the fungus that causes thrush loves a high sugar, low saliva environment. When I see a patient go from totally stable to a total mess, It's a huge clue that the entire environment inside their mouth has changed. And that change is very often being driven by an underlying issue that's feeding the bad guys and disabling the immune system. Here's where it gets really interesting, because this isn't a one-way street. We've talked about how high blood sugar can damage your gums. But the turning point is this. Inflammation from gum disease actively makes blood sugar harder to control. It creates a vicious cycle. High blood sugar weakens your gums and fuels inflammation. That inflammation makes your body's cells more resistant to insulin. Insulin resistance drives blood sugar even higher and harder to manage. The infection in your mouth is actively sabotaging your metabolism. The good news is that breaking this cycle works. Study after study shows that when patients with diabetes receive effective treatment for their gum disease, their blood sugar control improves. Doctors see measurable drops in HbA1c, the number used to track your 3-month blood sugar average and catch problems early. And the stakes don't stop with blood sugar. That cloud of systemic inflammation also targets your heart. The same inflammatory process that destroys bone around your teeth contributes to atherosclerosis, the plaque that builds up in your arteries. Even more concerning, specific bacteria from your gums, particularly Porphyromonas gingivalis, can escape into your bloodstream. Scientists have found these bacteria inside arterial plaque, where they accelerate the process that leads to heart attacks and strokes. Large-scale studies show that people with significant gum disease have a much higher risk of major cardiovascular events, with some data pointing to a 28% increased likelihood of a heart attack. Bleeding gums are not just a dental issue, they're a cardiovascular risk factor. The point of all this isn't to scare you, it's to empower you. These are the check engine lights your body has been flashing. The first step is simple. Stop normalizing bleeding gums. They are not normal. They are a sign of active inflammation and a signal your body is asking for help. Next, reframe the conversation with your dentist. Instead of saying, "My gums bleed," try saying, "I'm concerned about the inflammation and how slowly my gums heal, even with good home care. I understand this can signal an underlying issue. What's your assessment of my periodontal health?" That one shift changes the entire conversation. Then bridge the gap with your doctor. Take your dentist's findings to your primary care physician and say, "My dentist found chronic inflammation that isn't healing well. I'd like to be proactive and check my metabolic health, including fasting glucose and HbA1c. That test gives a 3-month picture and can catch prediabetes before it becomes diabetes. And finally, keep everyone in the loop. If you're diagnosed with a systemic condition like diabetes, lupus, or rheumatoid arthritis, your dentist needs to know. That information directly affects how your oral health should be managed. Your body is one interconnected system. The idea that the mouth is separate from the rest of the body isn't just outdated, it's dangerous. Stubborn inflammation, slow healing, and dry mouth aren't random. They're clues. They're your body's early warning system, giving you a head start on problems that might otherwise go unnoticed for years. When you learn to recognize these signs and ask better questions, you stop being a passive patient and become an active guardian of your health. Listen to what your body is telling you. It might be the most important conversation you ever have. If you found this valuable and want to keep connecting the dots of your health, make sure you subscribe and turn on notifications. The same process we talked about today doesn't stop with your heart. It has a surprising connection to brain health and cognitive decline. And that's something I'll be breaking down in an upcoming video. Thanks for watching.